Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Pastor Carlos Valencia from the Ignacia Batista Victoria in Cristo Church here in Fort Worth. After the invocation, please remain standing for our pledge.
Close enough.
Thank you very much for coming out today.
Thank you. Good morning, commissioners and everybody. So let's pray. Good and mighty God, we come to you today giving thank you because your word say that if we seek you with all our heart, you will answer. Today, we seek you with sincere heart and humble servant to our county. We thank you because you have allowed this commissioner to lead our county. We believe in your sovereignty and that there is a purpose for their leadership. We ask you for guidance to them and giving them wisdom. Our prayer is that they can trust on you and not lean on their own wisdom. In Jesus' name, amen.
Amen.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Judge, I want to publicly thank Pastor Valencia for his partnership with our prostate cancer initiative this past weekend. He contributed greatly to the crowd that we had that day, and it was a very, very successful event. And also thank you to Rachel from your office, who came and stayed the whole time. Thank you, Rachel.
I heard it was a very big success, and I again congratulate you for what you're doing in that particular area.
Thank you.
Mr. Manius.
Thank you, Your Honor. Members of the Court, we have three announcements relating to the court this morning. The first one is under the County Clerk's Office, item 9D1. We're going to ask that we hold that, and it'll be on the agenda at a future meeting. Also, members of the court, under purchasing, item 9I3, which is the acceptance of a rebate from Staples. We want to remove that from the consent agenda and put it, remove from the non-consent agenda and make that an item that, let me try that one more time.
Yeah, I think you were right the first time. You kind of screwed it up. You want to talk about it.
Good morning, Commissioners. How are you this morning?
Good morning, TK.
Okay, I misquoted myself one more time, Commissioner Johnson. We're going to take that off of consent and make it non-consent.
Which one? Excellent.
9I3. And then finally, members of court, on the appointment to various boards, I believe that Commissioner Brooks will have an appointment this morning.
That's correct.
Thank you, Your Honor.
Thank you.
Thank you.
Court members, you have before you the minutes of our regular meeting of February the 6th.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Motion. Do those things look like they're lit up? I'm lit up. Motion passes unanimously. Commissioner Johnson, I believe you have a resolution.
I do, Your Honor, for Greg Petrie. If you would read that into the record, please.
You bet. Whereas the first 911 call in the United States was completed on February the 16th, 1968 in Hallieville, Alabama, and whereas Tarrant County voters overwhelmingly approved the creation of the Tarrant County 911 Emergency Assistance District in April of 1985, and whereas Craig Petrie became the executive director of Tarrant County Emergency Assistance District in 2006. And whereas during Greg's tenure as Executive Director, he strengthened the relationship with the member cities by creating working advisory groups, including the Technical Operation Advisory Committee, the Training and Education Committee, and the Radio Inoperability Committee. And whereas his leadership in the area of training was so instrumental to the development of a training agreement between Tarrant County 911 and the Texas Commission on Law Enforcement, providing approved local training and testing for telecommunicator licensing. And whereas Greg led the way to develop a roadshow training format named Where's Waldo that reduced the documentation for locating a wireless caller from 3-inch binders to 1 sticky note, greatly increasing the search speed as well as the confidence that the caller's location was correctly identified. And whereas he led the design and implementation of a new next-generation 911 network infrastructure, demonstrating the spirit of his motto, we have a plan today to implement technology 2 years from now that hasn't even been thought of yet. And whereas after 41 years, Greg is retiring from public service this month, now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby congratulate Mr. Greg Petrie for his retirement and commend him for the stellar career dedicated to the highest levels of public safety and wish him continued future success. In witness whereof we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 13th day of February 2018.
I move for its approval.
Second.
We have a motion, a second. Please vote. Motion passes unanimously.
Greg, I want to tell you that we appreciate so much what you have done in this area, not just in Tarrant County, but in the full 911 area that you serve. You have done it very admirable, and we appreciate what you have done. We're going to miss you, I can tell you that. But if you'll meet me at the podium, please. I forgot to introduce your wife, so you want to do that?
This is my wife, Sarah. We've been married for 35 years.
All right. We are completely blind.
Yes.
Thank you, and good luck to you.
Thank you very much, sir. Thank you. I may need your help. Commissioner Johnson, Judge, Commissioners, Mr. Manius, Mr. Brunson, thank you very much. I was told to come over this morning and accept a plaque commemorating the anniversary of 911. Well, that was one item that you mentioned, but thank you very much. You'll rarely hear me use the word I, because it takes a team to achieve everything. But today, I am very humbled by this honor and this recognition. My darling bride of Sarah, to literally thousands of call takers I've worked with over the years, to the staff of the district, it took all of us to accomplish the items that you have listed. 41 years ago, when I began my public safety career as a part-time weekend dispatcher at the Randall County Sheriff's Office in Canyon, Texas, I had no idea I would be honored in such a way as I ride off into the sunset. Again, thank you for this recognition and your continued support of 911 and especially the Tarrant County 911 District. Thank you again.
Thank you again very much, Greg. Court members, you have before you the consent agenda with the changes as indicated earlier.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously. Mr. Manius.
Thank you, Your Honor. Our first item is going to be presented by Ms. McMillan.
Good morning, Judge, Commissioners. Last week, the Commissioners Court was presented information on a requested tax abatement by Airborne Tactical Advantage Company for the location of a new maintenance hangar and operational hub at the Alliance Airport. We provided a term sheet for which the performance criteria was set to be put into the abatement agreement, and that has been drafted. So today we're requesting that Commissioners Court approve the resolution and tax abatement agreement providing for Tarrant County and Tarrant County Hospital District participation with the City of Hazlet in the abatement of ad valorem taxes on the eligible real and personal property improvements made by Airborne Tactical Advantage Company, LLC, for the construction of a new aircraft maintenance and operations hangar at Alliance Airport for a period of 10 years on a maximum abatement percentage of 50% as set forth in the agreement, and authorize the county judge to execute the agreement.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Ms. Tidwell. Good morning.
Good morning.
Morning.
We have one item we're asking the court to consider today, and that is to receive and file the auditor's report related to the review of the financial accounting and system controls for the tax office accounting section, and you have the response attached. We will continue to work with Mr. Wright's staff and his office, and we work cooperatively together, so we feel certain that we'll be able to resolve these.
Thank you. Move to receive and file.
Second.
We have a motion and a second to receive and file. Mr. Wright, do you have?
I do. This seems as good a time as any. It's something I've wanted to say to the court for a very long time, and that is I believe we have the best county auditor in the state of Texas. Her office does an outstanding job. There's no question that she and her people have helped make me a better tax assessor collector and make the tax office a much better tax office. And thank you. That's all.
Thank you.
Thank you.
Any other discussion? Please vote. Motion passes unanimously. Helen.
Good morning.
Good morning.
The Risk Management Board seeks approval, your approval of a claim for $8,028.07.
Move for approval.
Second.
We have a motion and a second. Any discussion?
It's a high-priced light fixture, I'll have to say.
Concrete.
Concrete?
It was concrete.
Please vote. Motion passes unanimously.
Good morning.
Good morning.
We have two items for the court this morning. The first item, we're asking the court to receive and file the personnel agenda.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you. And our second and final item, we're asking the court to approve a waiver of terminal benefits for the district clerk's office. Mr. Wald is requesting a waiver of 320 vacation hours effective March the 1st. We're estimating the net cost to the general fund to be a little bit more than $3,100, including fringe benefits.
Move approval.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
Thank you.
Mr. Beecham.
Good morning. Court members, we have two items for your consideration this morning. Our first item is an item in regards to bid 2018-048. It's our annual contract for armored car services. We are recommending or asking for permission to reject all bids and rebid with revised specifications. This contract expires September 30, 2018. Prices went up a little bit, but we've had no backup for quite some time, which is what we're trying to accomplish. I feel like this is on a slippery slope unless we have a backup service in place.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
And item number 3, thank you for allowing us to make this a non-consent item. Just want to thank Staples as a partner. This is the 5th year that we are able to bring to the court a rebate. Our rebate for this particular fiscal year, which we've already received the money, is...
You mean we're not going to get a big check?
we tried to save a tree. It was as big as GK's desk, but no cardboard check this year. But the rebate this year that we are bringing to the court from Staples is a rebate in the amount of $316,528.99. This is the second largest rebate that we've been able to bring to the court with their partnership and the 48 entities that participate in this contract in the last 5 years. This is a contract that's turned into a $10.5 million contract. We couldn't do it without Staples' partnership, obviously with the entities participating, and thank you for allowing us to have this program in place.
Now, this is what came to Tarrant County?
Yes, sir.
Weren't there other amounts that went to?
There's the backup. There's a listing of all the entities that participated with a listing, looks like this, all the listing of all the entities and the percentages that were rebated to each particular entity.
So the total rebate under the master contract was what?
$413,387.28.
And our 300 or so of which belongs to Tarrant County,
Yes, sir.
based on our own purchases, right?
Our spend plus a little bit of theirs. And if you remember several years ago, 2 years ago, as I remember, the court increased that spend. The entities got the benefit of that. We took a lesser cut. We knew this year going in, DISD has been one of our largest participants. We knew their spend was going to be down early in the year, but again, a $10,550,966.30 contract. It's a pretty good deal for everybody in the Metroplex. And we again appreciate people's participation and allowing us to have this program in place.
I could have a motion that we receive and file this.
So move.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Actually, that was an acceptance of the donation, not a receipt. Acceptance.
What he said. Commissioner Wynn, I believe you have an interlocal agreement.
Yes, Your Honor. This is an amendment to a previously approved interlocal agreement with the City of Dalworthington Gardens. I move for its approval, item 9L1A.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Brooks, I believe you have an appointment.
I do have an appointment, but before I do that, whenever you start passing out thanks to people, you always forget somebody. Benny Tanaja, for the 4th year, provided the educational piece of our prostate cancer event. He's always well received. He has become quite a rock star for this event, and thank you, Benny. Thank you. Now for the appointment, I want to appoint Mr. Matthew Kennedy to the Child Protective Services Board to replace Karen Lovett, a Precinct 1
I'll second that.
appointee.
Okay, we have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Johnson?
Judge Molly Jones and myself need to be reappointed to the bail bond board.
I'll move that we appoint Commissioner Johnson and Judge Molly Jones to the bail bonds board.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
Thank you.
Court members, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Do we have any briefing items, Mr. Lee?
Yes, Your Honor, we have one item, and it relates to a public health update, and Mr. Zanez is here to address the floor.
When am I going to get rid of this cough?
I'm sorry, I didn't.
When am I going to get rid of this cough?
Oh, well, it depends.
Good answer.
Can go a long time, I'll tell you that. It's just that season this year. Well, good morning, Commissioners and Your Honor.
Morning.
This is just an update again on our influenza situation, just to kind of keep you apprised of how things are progressing. This is our national view this week, the week ending February 3rd, because the data lags a little bit. So that was the 5th week of the year, according to CDC. You can see we're still pretty high across the country. And the reason
The reason there's nobody in Montana, because those are all cows up there. We haven't figured out how to determine when a cow has the flu yet.
Correct. No, a lot of times surveillance data lags, and I'm sure they have flu, but the activity is not as widespread as we've seen all across the country, really. And the reason I put this map up and a next slide like this, I was actually starting to get a little excited over the last couple of weeks. I had been noticing a trend. The western half of the country was starting to turn colors to a lighter shade, so flu activity, in my mind, was going to come down. Well, this week kind of knocked that out of the park. We're back up again on influenza-like illness. So I didn't put all of those time series maps on there, but that gives you an idea. The map on the left is the one where it was the week before, shades were lighter, and then we're back up again. And Texas is sort of following a similar trend. It's, again, concentrating very heavily around major population centers. That's to be expected. And that's the theory behind that Montana comment as well. If you have dense populations, flu spreads from person to person, so that's more easy to spread when there's more people around. If you live far away from each other, social distancing really works, and that's why flu activity is kind of low in a lot of our rural communities as well, because the population density is just low. It doesn't mean that there's no flu there, it's just that the density is low, so it doesn't show up very heavily on the map. Hospitalizations continue to trend higher, but this is a cumulative map for the season. The real picture really is this. On a weekly basis, we're actually in a good shape nationally. Senior hospitalizations have been coming down for this is the fifth week in a row. So that's good news. So hopefully that starts to show good results here soon. You've probably heard in the media a lot of comparisons to the previous H3N2 heavy season, which was 2014-15. And I just wanted to make sure that you had the availability of this map or graph here. We're trending pretty similar to what we saw in 2014-15. Despite all the other things that you hear, it's a pretty bad season, which it is. We are experiencing a very heavy outbreak of flu. But from a hospitalization standpoint, nationally, we're pretty on track to what we saw in 2014-15. Now, the data does lag, so if something changes next week, we'll let you know, but so far it's looking that we're following the same trend. Influenza-like illness, however, has surpassed that 2014-15 peak, which was the pink line, and we're now past the peak that we saw during the 2009-10 H1N1 season. So that hit the news this Friday. CDC came out and saying that we're experiencing the heaviest season since H1N1. So this takes into account all the influenza-like illness that we see around in the community. Almost everybody has had that experience, either themselves, friend, family member, somebody's come down with a flu or a flu-like illness, and this is reflective of that. So it's nationwide. We're seeing a very heavy outbreak of flu. Texas, again, after a little break, trended up higher, more than 14% influenza-like illness. And as soon as I put this slide out and send it in for the agenda, later that afternoon on Friday, DSHS did release updated slides. So this week, the activity has trended down a little bit, so we'll try to update that and capture that in the next presentation. Tarrant County information, we're above our 2014-15 peak of influenza-like illness. And I compared with the 2009 H1N1 season. We're above that as well, but the data collection wasn't as robust in Tarrant County at that time. And post H1N1, we've had a lot of good data collection. So we could have missed something in that time frame, but this one, I have confidence that we are above the 2014-15 season at this point. Again, what should we do as a community? Because this is an opportunity for me to remind everybody, anybody who's watching or if any media partners are listening, then people always question the efficacy of the flu shot. And yes, we understand that it's not highly effective this year. And that happens from time to time because the virus just changes on us from time to time. But again, any protection is better than no protection, so we still recommend take the flu shot. There's varying numbers that have been thrown around, but generally what we've heard in the media is 10% effective this year. But 10% is better than 0% any given day. I'll take it. I've taken it this year, and I'll take that protection on top of 0% any day. So take a flu shot if you haven't taken it, even though it's kind of late in the season. We still have all of February and March to go. Like I was saying last presentation, influenza A kind of starts to subside a little bit, and influenza B starts to pick up. We're seeing that in our laboratory surveillance data. And what I wanted to mention is that if people have not taken a quadrivalent flu shot, they need to do and take that, because the influenza B strain that's in the trivalent flu shot is not the one that's commonly circulating right now. It's
So
the
what
one
they'll give us.
Quadrivalent. The county has quadrivalent strain. We didn't get the trivalent this time around. So the quadrivalent strain has that other strain of influenza B that's been actually almost 10 to 1 circulating right now in the community. So if you haven't taken a flu shot, make sure you take the quadrivalent flu shot. And then this is a big message for our county employees, for other workers out in the community: stay home when you're sick. And if there's an employer who does not have a policy stance about allowing people to go home when they're sick, they need to think about it. If you let a sick worker stay at work, you're probably going to have your workforce out in the next few days with illness. So they need to start thinking about that and allowing people who are showing symptoms at work to be sent home and go home, stay till they're better. And usually it's 24 hours after your fever has subsided without any fever-reducing medications, and that's when it's safe to come back to work. And this is a general sort of statement, without knowing whether you have influenza or not. Let the fever break, 24 hours have passed, then come back to work. And antivirals are very key early on. If you know you have the flu, you've gone to a doctor or a quick care clinic or whatever healthcare provider, and they think you have the flu, get on antivirals right away. We're seeing a lot of information coming in about influenza deaths. Tarrant County now has about 28 adult deaths reported as of close of business yesterday, which is the heaviest recorded season that we've had on record. Now, again, repeatedly I have said this is anecdotal information. It is not a reportable condition, so what that means is the actual death count could be a lot higher. But, those are the reports that we get through good, friendly relationships with healthcare providers, long-term care facilities, and so forth. And it's a good indicator that it is a very severe season. And the best way to protect yourself, if you haven't taken the flu shot, you have the flu, get on antivirals right away. So those are some key messages that we have, and I'll be more than happy to answer any questions that y'all may have.
Are there any questions?
All right, thank you.
Thank you, Benny.
Your Honor, that's all we have at this time.
Before we recess, I want to just make one comment. Faye Ballou with the United Way has been here many times. Yesterday, she found out that her son, who was in the Air Force up at Altus along with his wife, that he had been killed instantly, and he had been out running or jogging and had been hit by a truck and was killed instantly. At the same time, his wife and her father had been preparing for final arrangements for her mother. So I would just simply ask that you please keep Faye and the Ballou family in your prayers. There's not many words, there's no words that you can say at this point in time. So please just keep them in your prayers.
And Your Honor, I would like to ask the court to close today's session in honor of Mr. Bruce Kephart, who passed away recently. Bruce has served Tarrant County on the CPS board as chairman, and also served on the JPS board as well. So keep his family in prayer as well.
Yes, most definitely. With that, I will recess our open meeting, proceed to close to discuss items exempted under section 551.071, 072, 074, 077, 076, and 087 of the Texas Code.
Yes, he is. He's here, Commissioner. You get hold of him?
I did. He is in Austin and unavailable.
Unavailable, okay. No, I'll have a representation over there. Yeah. Steve.
Roy, are you
Yes,
going
sir.
to our transportation summit on Friday?
I don't think so, but I'll be represented.
Having returned from our closed session, there being no business to conduct at this time, we stand adjourned.
This is one of his fundraising gimmicks.
How is it?
It is now.